Hello there everyone, and we thank you for joining us for the Matt's Weather Weekly Weather News. Today is Wednesday, April 10th, 2013. And to continue on with Autism Awareness Month this week, today we're going to be talking about all the different types of autism that there are. Today we're going to be talking about Asperger Syndrome, Pervasive Developmental Disorder Not Otherwise Specified, which is abbreviated PDD-NOS, Autistic Disorder, Rett Syndrome, and Childhood Disintegrative Disorder. We're going to be starting with Asperger Syndrome. Asperger Syndrome, which is the mildest form of autism, Asperger Syndrome affects boys 3 times more often than girls. Children with Asperger Syndrome become obsessively interested in a single object or topic. They often learn all about their preferred subject and discuss it non-stop. Their social skills are markedly impaired, though. They are often awkward and uncoordinated physically. Because Asperger Syndrome is mild compared to other autism spectrum disorders, some doctors call it high-functioning autism. As children with Asperger Syndrome enter young adulthood, though, they are at high risk for anxiety and depression. And just in case you were wondering, Asperger Syndrome got its name from Dr. Hans Asperger, who was really the very first doctor ever to research anything like this back in the 1940s. So that's why Asperger Syndrome is called Asperger Syndrome. That's where it got its name from. Okay. Pervasive Developmental Disorder Not Otherwise Specified, which is abbreviated PDD-NOS. This mouthful of a diagnosis applies to most children with an autism spectrum disorder. Children whose autism is more severe than Asperger's syndrome, but not as severe as autistic disorder, are diagnosed with PDD-NOS. Autism symptoms in kids with PDD-NOS vary widely, making it hard to generalize. Overall, compared to children with other autism spectrum disorders, children with PDD-NOS have impaired social interaction like all children with an autism spectrum disorder, better language skills than kids with autistic disorder, but not as good as those with Asperger's syndrome, fewer repetitive behaviors than children with Asperger's syndrome or autistic disorder, and a later age of onset. However, no 2 children with PDD-NOS are exactly alike in their symptoms. In fact, there are no agreed-upon criteria for diagnosing PDD-NOS. If a child seems autistic to professional evaluators but doesn't meet all the criteria for autistic disorder, he or she will likely be diagnosed with PDD-NOS. Okay, and autistic disorder. Children who meet more rigid criteria for a diagnosis of autism have autistic disorder. They have more severe impairments involving social and language functioning, as well as repetitive behaviors. Often they have mental retardation and seizures as well. There are 2 rare severe forms of autistic spectrum disorder that are considered separately from the others: Rett syndrome and childhood disintegrative disorder, which are going to be the next 2 that we talk about right now. Rett syndrome, almost exclusively affecting girls. Rett syndrome is rare. About 1 in 10,000 to 15,000 girls develop this severe form of autism. Between 6 and 18 months of age, the child stops responding socially, wrings her hands habitually, and loses language skills. Coordination problems appear and can become severe. Rett syndrome is usually caused by a genetic mutation. The mutation usually occurs randomly rather than being inherited. Treatment focuses on physical therapy and speech therapy to improve function. Okay, and childhood disintegrative disorder. The most severe autism spectrum disorder, childhood disintegrative disorder, also abbreviated as CDD, is also the least common. After a period of normal development, usually between age 2 and 4, a child with CDD rapidly loses multiple areas of function. Social and language skills are lost, as well as intellectual abilities. Often, the child develops a seizure disorder. Children with childhood disintegrative disorder are severely impaired and don't recover their lost function. Fewer than 2 children per 100,000 have an autism spectrum disorder meet criteria for childhood disintegrative disorder. Boys are affected by CDD more often than girls. So, obviously, if you have any questions about that, feel free to email me at mattsweather1 and I will address those questions on the web show either next week or the week after that during Autism Awareness Month. Now, also, next week, I'm going to be unable to do the weather news on Wednesday, so we're going to be doing the weather news next Monday, or this upcoming Monday, I should say, April 15th. So, again, I'm going to be unable to do the weather news next Wednesday, so we're going to be doing the weather news this upcoming Monday, April 15th, where we'll be talking about high-functioning autism, and we're going to be talking more about Asperger's Syndrome in a little bit more in depth. Okay, now we're going to give you your WFSB Channel 3 early warning 7-day forecast. Tomorrow, Thursday, April 11th, cloudy and much cooler. Showers and drizzle. High 52 degrees inland, 55 at the shore. Yesterday, Tuesday, and today, Wednesday, have been absolutely beautiful weather days. I hope if you haven't yet gotten the opportunity to go outside and enjoy it, please go outside and enjoy it. It's a beautiful evening, afternoon and evening for a nice walk outside or anything outside. But it's going to be a little cooler tomorrow, like I just said. Then on Friday, periods of rain, heavy at times, breezy and quite cool. High 46 degrees inland, 52 at the shore. Saturday, partly sunny and breezy. High 60 degrees inland, 61 at the shore. Sunday, mostly sunny and breezy. High 60 degrees inland, 60 at the shore. Monday, mostly cloudy, a chance for showers. High 64 degrees inland, 60 at the shore. Tuesday, mostly cloudy, a chance for showers. High 65 degrees inland, 61 at the shore. And next Wednesday, April 17th, partly to mostly cloudy, a chance for showers. High 68 degrees inland, 61 at the shore. So that'll do it for the Matt's Weather Weekly Weather News this week. We have no guest viewer segment this week. If you're interested at all in the guest viewer segment, you can email me at mattsweather1, the number 1 at AOL.com. And we hope you join us for the Matt's Weather Weekly Weather News this upcoming Monday, April 15th, not Wednesday, because I'm going to be unable to do it on Wednesday, where we're going to be talking more about high-functioning autism and Asperger's Syndrome. We're going to get a lot more detailed about what that is on Monday. So we hope you join us in. We'll see you then.